Hi, good afternoon, Professor and fellow classmates. My name is Lisette Campos Cuevas, and I will be presenting to you a case that I experienced last week in my clinical settings. I was in a pediatric clinical setting. This is a 10-year-old female that presented to the office with her mother, and both appear to be reliable historians. The 10-year-old girl presented to the clinic with a history of the past 3 days of shortness of breath, cough, and wheezing. She reported, or they both reported, that there were no clear triggers for her respiratory symptoms, although she did have noted that she had some mild upper respiratory tract infection within the past 2 weeks that had resolved. With this episode, the mother and the patient state that she had been using short-acting bronchodilators more frequently than she had in the past, without any expected resolution of the symptoms. The mother states that her daughter is very knowledgeable on using her inhaler and has been using it for the past years without any problems. On the day she presented to the clinic, the patient awoke feeling suffocated. Her mom states that she had a light tinge in blue to her lips. When she presented to the clinic, her oxygen saturation was taken and it was 92. Her respirations were charted at 32 breaths per minute. She did have a slightly increased work of breathing and poor air entry bilaterally to both bases of the lungs. The patient also had wheezing bilaterally to both lungs. She was treated with steroids in the office, and a chest x-ray was ordered that showed hyperinflation and non-focal findings. Her past medical history does include allergies to peanuts, grass, and seasonal pollen and allergies. Her medical history revealed that she was followed by a respirologist for her asthma and had good medication adherence and had not experienced a significant exacerbation for the past 6 months. She also had a history of wheezing, dyspnea, and pruritus with any exposure to peanuts, chickpeas, and the lentils. But she had been prescribed an injectable epinephrine device for this. However, on this day, she did not have it in hand, so it was not used. In the past, her wheezing episodes had been only seasonal and related to exposure to grass and pollens. This presentation occurred during the winter. This patient mother states that the patient's father does have a lot of allergies to many things, including peanuts, seasonal allergies, grass allergies, and is very sensitive to many seafoods and pollen. The mother denies having any medical history herself, and that her grandparents are alive and well and do not have any medical problems. So this patient was treated with the albuterol and the steroids. The chest x-ray was performed, which showed the hyperinflation and no focal findings. So I would like to see what you guys think about the case and what are your recommendations, and we can discuss further along what other management we did. Thank you.